What really struck me about Dignity Day was everyone coming together with great enthusiasm and dedication to help really celebrate what good work we already do in our trust, but also reflect on how we treat others and what it means to us. All of our Dignity champions and volunteers should be proud of what they achieved that day, and the day could not have been a success without them and their hard work and dedication. Dignity and respect transcends to everyone, both staff and patients. If we treat each other with dignity and respect, this will show in the quality of care we give to patients each day. Often the smallest gestures can have the biggest impact. It could be sitting down with a patient for a couple of minutes whilst giving their medication, dedicating your time to ask them how they are feeling, or thanking a member of staff for going the extra mile.
So my involvement was really through the Culture Working Group, as I coordinate the activities of that group.
I volunteer with the Trust here, but I'm also an agent of change trained by West Midlands Leadership Academy. I'm also a patient leader trained by Diabetes UK.
So I run a series of programmes for the Trust that revolve around leadership, teamwork, culture change initiatives, and within that we talk about how we model behaviours that are desirable in our workplaces. Sometimes that could be working with our directors and other times our regular staff throughout the Trust. So I feel really strongly about taking that opportunity to encourage staff to model the behaviours that will be beneficial to supporting the concept of working with respect and dignity for others.
I've been trained by the West Midlands as an executive coach to master's degree, and it's just delivering training. I'm able to deliver training both to staff and to patients or volunteers to help to improve the system and to improve the journey for patients.
My main involvement has been in the Dignity Board, helping to set up the Dignity Board, put together in collaboration with the lead of the Dignity Board the contract of commitment for the members of the board, and alongside the Dignity champions themselves, we have at the Dignity Board freedom to speak up advocates, people from complaints, patients and volunteer representatives, anyone who might be out in our organisation feeling the temperature of the culture, and a chance to triangulate discussions, activities, data, and talk about what's going on.
Insulin-dependent diabetic that's lost my sight because of my diabetes.
So I feel really strongly about creating a working environment where everyone can feel safe, respected and valued in the workplace, so they can enjoy their work and perform to their optimum. That for me starts with being treated with respect and dignity.
The Dignity Champion strand seemed to fit perfectly into the overall work that we do in our trust with culture.
Our goal is to make a difference.
I'm in a really fortunate position where each month I meet with our trust new starters through the forum of corporate induction, and during that session we talk extensively about our trust values. So that's something I'm able to cover during that session, where we talk about what it is to treat people with respect and dignity so they can go about work effectively and safely.
Dignity means to me about being heard. There's lots of times through my care where I've not been listened to, where assumptions are made. I don't feel as if sometimes I've been treated as a whole person. I've been treated as a condition. And dignity is about respect. It's about listening and listening actively, with the purpose of making things easier for that individual, whether that's making sure the tulips are watered at home, or whether it's about going to the bathroom or finding where the bathroom is.
I support and coordinate clinical placements for students, and it's absolutely vital that our staff are positive role models for the future generation. So it's essential that they are exhibiting appropriate behaviours in terms of respecting patients' dignity, but also in terms of supporting their students so that the next generation have the appropriate professional values.
Dignity is something that I'm always reiterating to the team and to staff, and I think if you treat everybody with respect and dignity, then they carry on, and it just is it's like a growing mushroom really. It just evolves in front of you, and it's just putting it forward all the time that dignity and respect is the two things that everybody needs to have when entering somebody's home or different circumstances, is to always have that in the back of your mind.
I was interested in being a dignity champion because dignity to me is fundamental to my role as a nurse. It's very much part of my role as a freedom to speak up advocate within the organisation as well. So my role is about supporting staff members who at times feel that they haven't been treated with dignity in the workplace. Perhaps they've had a particular issue with a colleague or even a line manager. So it's about ensuring that those people are supported.
So a Dignity Champion serves as an ambassador for our trust. They challenge unwanted, undesirable behaviours and models of behaviours that we'd expect to see in others around dignity and respect, to create that safe working environment where everyone can feel valued and respected.
It's really important that staff remember to call students by their name rather than calling them the student. That depersonalises, dehumanises them, doesn't make a student feel valued by the team.
I think a Dignity Champion is one of our custodians of the values, as we all should be. But I think they take an extra responsibility, if you like, for standing up and holding people to account for living the values, whether among staff groups or with staff and patients, patients to staff, so that everybody is involved in treating each other with dignity and respect.
For me, a dignity champion is someone who is a role model of how we expect our staff to behave, how we expect to treat one another across the organisation. So very much an ambassador of how we expect our staff to treat each other, to treat our patients and our students.
Measurements that are already happening, improving, but whether you could say that was down to dignity or other things that are going on within the trust, I think would be quite hard. They are so excited about things going right that they're talking about it, and that, I think that could be a measure of dignity. But as I said, there's lots of other things that thread with dignity that is part of the whole package really within the care element within the trust. I think it's a really difficult one to measure because they're talking about soft skills. I think there would be a reflection through staff surveys. There would be a change within staff surveys because of dignity, treating yourself with dignity and treating one another with dignity in-house. I think that could be a real measure there, a practical measure of that.
Treating our patients with dignity is very much part of the NHS Constitution. It's also within the professional code for nurses, the importance of treating our patients with dignity. So for me, it's both a moral and a professional duty.
A few years ago, in my palliative clinical nurse specialist role, I was referred a gentleman who lived in a very remote area, in the hills north of the county. When I arrived at my sat-nav destination, I was on the edge of a field, in a lane, surrounded by hills and sheep. The directions I had been given by the patient advised me to park at the gate and walk through the field. There was a lot of excrement around. It didn't look like cow or sheep manure. On arrival at the house, I found a very emaciated looking gentleman, obviously struggling to mobilise due to pain, and it was his wish to die there. He had a well from which he got his water, but no sewerage supply, and used to place the contents of his commode on the field, hence what I'd seen. He did not want any intervention, care, etc., but after a couple of visits, building some rapport with him, he agreed to accept the offer of some pain-relieving medication, which did fortunately have an immediate effect, enabling him to at least mobilise with less discomfort. The main thing that he continually expressed to me was that he did not want any intervention at all, but dying in the farmhouse where he was born was the most important thing to him. My experience was taught me that you cannot always fix things. A patient's situation and wishes may be far from what we would want for ourselves and may be detrimental to their well-being, but we have to respect what is important to them. The patient's wishes or preferences are paramount. He would only allow myself and the GP into the house to see him, so between us we agreed to visit each week and deal with whatever we found. After lots of discussion, he agreed to having medication in the house, which we termed just-in-case medication. This medication can be administered immediately as needed by injection to control symptoms, for example pain. The situation was far from ideal. It was difficult to see a patient in pain, losing weight dramatically, and denying himself care help that he could have had. But he had capacity and he knew exactly what he did and didn't want. Dignity is about appreciating and respecting a patient's wishes, treating them as an individual and not showing any bias or prejudice, showing patience and understanding towards our fellow human beings.
I was eventually, almost as a last resort, assigned to a diabetic nurse. And this diabetic nurse was the making of me. She respected me, she spoke directly without innuendo, she was listening to what I had to say, she understood my fears and my concerns, she treated me as a mum of 4 and the difficulties that diabetes has with that life pattern and those life difficulties, the reality of living with diabetes. She understood I was fed up and I was angry and frustrated and not very emotionally resolved with my condition. And she came alongside me as somebody who showed me a really deep level of respect, and I was able to trust her.
I've been coming to this starch unit for approximately 5 years for weekly infusions of magnesium because I've got several illnesses, but what they think is causing the low magnesium, I've got a bowel disease, diverticular disease, and the more you go to the toilet the more you lose your electrolytes out of your body. So basically I just come here and have my treatment.
I've lost my sight, but she has opened a door to me where I've been able to acknowledge and accept my condition and come to a place where I can help others.
Go out of their way here to accommodate me, you know, not just me, but other patients.
And that level of degree of dignity that she gave to me was far beyond what I'd ever experienced before, enabling me to acknowledge my condition.
Recently my wife broke her leg and they was always used to Kath bringing me here. You know, and when I walked in with a different person bringing me here, I said, oh, where's Kath like now? They showed concern straight away. They asked how she was when I explained what the situation was and things like that, you know. And it's just things like that where they go that extra little bit because they take Kath as part of me.
I've lost my sight, I'm not deaf. I'm not disabled, mentally disabled. I can answer whether I need 2 sugars or non-sugar.
When you go to a unit, a ward, and what they're going to do, it's got to be explained to you so you can understand what's going on.
But often, sadly, I'm talked over as a patient rather than being talked to.
Like when I first came to darts, yeah, I was very, very apprehensive. You know, what's it going to be like and things like that. When I came through them doors there, and there was a nurse called Annette, she's not here no more. Oh, welcome, you must be Alan, you know, show you where you got to go. She explained everything to me. You know, right from that start you thought.
I have a guide dog, and this is Tammy, my guide dog. People show me respect by respect and dignity by talking to me first rather than my dog. We are a British culture. We love animals, and the tendency is to focus in on the animal. But she's a working dog. She enables me to get about. Most of the time, people treat me with dignity because they understand that she is a working dog. But that's not always the case across the country.
I've had epidural anaesthetic for a big operation where they had to remove like some growths in my hip. Yeah, which is a very long operation. It's stressful enough being awake for it during the procedure. Then you're taken back to the ward, and because you've had an epidural, you've got no feeling from the waist down. Yeah, and I felt underneath the sheets the one time, and I knew that I'd wet myself. You know, and I got the attention. The nurse, and she come over and yeah, we'll be with you in a minute, yeah. And I think I was left in urine from about 8:30 in the morning till about 1:30 when my wife arrived. And she actually went to a nursing station. Why has it been left like that? Oh, we forgot about it. I've had another bad experience where I had a spinal tap, checking my fluids in my spine. I mean, being told you might have meningitis is bad enough. Right, then to lie down, have that done, then afterwards you're not allowed to get out of bed. I went to the nurse's station the next day, you know, in a ward, and I said, excuse me, wasn't rude or anything like that. Can you tell me when somebody can come and remove this, please? It's getting a bit sweaty and that. There's a dressing on the back. She pulled the dressing gown up, the sister did, and she just ripped it off. I said, there you go, it's off now, and dropped my dressing gown. And that was in the nurse's station, which is like central to all the wards. Again, to me, there was no need to do that. She could have took me into one of the side rooms, washed her hands, and dealt with it in a proper way. But if I had to go through that again, I hope, or any patient would be shown a bit more dignity and respect than that I was.
Dignity is in everything we do, not just one particular service. So I think it's important that we do have regular get-togethers and discuss things that we've celebrated and done well, and you know we're promoting what we're doing, and also things that we can learn from, and maybe we could have done that slightly better.
For there to be a more higher profile of dignity champions, and you almost like we become wallpaper. Our wall is covered with hundreds of faces of people who are dignity champions that are looking out for that exceptional care, to complement, to encourage, and to challenge where it needs to be challenged, and to ask the question: Are you okay? Are you looking after yourself? And to ask those questions as well as saying, I think you could have handled that a little bit better, or how would you handle that a bit better?
It was championed, promote it. That's what I'm saying, try and promote it. About how, I'd love to know how nurses feel about it. But you don't get to hear of that side of it. But I don't know if you're going to go to more patients and get their experiences, which would be a good idea, and perhaps then show it to nurses, staff, even on the wards, to let them know how a patient feels. It's bad enough going into hospital for anybody, but if they can feel what the patient is going through, I think that's very important.
We need to raise the awareness. It mustn't be allowed to go into the background. We need to keep it at the forefront of everything that we're doing, because it's going to improve everything that we do across all the different services, if we're treating people with dignity and respect, then the service that we are providing is the best that we can in treating people as they should be treated.
If it gets that much over to make a patient feel better while having treatment, I think it's a good thing.
Work with students, I can ensure that all students are aware of the dignity work through student induction packs, through face-to-face conversations with students about their experience of the Trust, and also through online platforms as well. So each of the universities has an online platform that I can put information on to further promote the work of dignity. At Trust Induction, as well as a Freedom to Speak Up advocate, I'm often involved in induction, so through that route I can help to ensure that our new staff to the Trust are aware of the dignity champions and the work that we are involved in across the organisation.
But maybe in other units, they can learn from my experiences. Well, I've had bad experiences with dignity, but also been shown great dignity, compassion and care. And I think it's very, very important to get that over.
"30 dignity champions in the Shropshire," and that is a real something to shout about. That's really important.
I think it's imperative really that everybody that we come into contact with is treated with dignity and respect.
Wow, I'm a dignity champion. What's involved with that? What's that about?
NHS is a family, yeah? When we come into hospital, we're being brought into that family, and we'd like to be just like have dignity and respect shown to us.
There needs to be a higher profile of dignity and champions, and it needs to be plastered on the walls.
Keeping it alive and growing the momentum is the most important thing really.
They always return the call, always, and that makes you feel a bit more better.
Being able to build and work with the dignity champions to say it's okay to boast, it's okay to shout about what you've been doing and how good you are. It's okay to speak about the care that you give to people.
I hope they take on board how the patient really feels, and when they have bad experiences, think I might be able to improve that.
It's every day in everything that we do. It should be there, and we need more people to be dignity champions within the Trust.
It's really important that we remember those little things in terms of the way we communicate with one another.
It takes 30 seconds, if that, just as you're walking past, opening the blinds, opening the windows.
People come to work to care. They don't come to work to punish people. They don't come to work to be horrible or to not show dignity. But it's that balance about saying thank you. I know you're really busy. Take 2 seconds to say hello. My name is.
That extra good night or good morning, or do you need any help with that, your slippers or anything like that? That's going that extra mile to me.
Everything we do, it is important in patients' homes, but also that we treat our work colleagues with dignity and respect.
Remembering to introduce yourself to a patient, also remembering to ask the patient how they want to be addressed. It's those simple touches.
We've all got feelings, every one of us, yeah? And just to say thank you to them as you're leaving and things like that, that means something to them, right? It also means something to me when I'm having my treatment, yeah? Yeah, I know I'm going to be okay, because I can trust them.
Whether you're a patient or whether you're a staff member, whether you're a HCA or whether you're an executive, there is that need personally to treat yourself and expect from yourself dignity.
Careful, that's what it means to me.
For me, dignity is a human right.
I think it should be at the forefront of everything that we do as a trust.
Dignity for me is a place where you can be assured and confident in the people that are around you.